Modern urban planning frequently optimizes for density and individual square footage. Yet, by prioritizing physical enclosure over shared social infrastructure, standard housing models often inadvertently engineer spaces that lack natural points of human connection. This architectural disconnect removes the casual, daily interactions required to maintain neighborhood cohesion. Over decades, the design of communities without interactional hubs has emerged as a significant factor behind modern epidemics of emotional isolation and community fragmentation. The physiological consequences of isolation are severe. Surgeon General Vivek Murthy has established that the modern loneliness epidemic poses public health risks comparable to smoking, increasing the statistical likelihood of cardiovascular disease, dementia, and premature mortality. Standard affordable housing models prioritize basic metabolic and safety needs, often leaving the spatial requirements for psychological health and relational trust unaddressed. Urban isolation is rarely a personal failing. It is a design-induced public health crisis, one that requires a rigorous, interdisciplinary structural intervention to solve. The Alam Happy Town, or AHT, framework is a research-based intervention resulting from 5 years of study by Dr Syed Aftab Alam at BWO Researches International. It functions as a controlled environment for testing urban well-being theories. The model investigates a central research question: can housing communities be intentionally designed to create sustainable happiness, emotional security, and human flourishing? To answer this, AHT operates as an interdisciplinary living lab methodology. It is designed to rigorously evaluate how specific physical environments may contribute to measurable psychological, behavioral, and communal outcomes. Design work applies established psychosocial theories to exact spatial scales. It begins at the interior geometry of a single unit, expands to the pedestrian network, and scales up to a regional infrastructure model. By mapping these environments, the AHT framework positions subjective human states, like emotional resilience and belongingness, as dependent variables that can potentially be influenced by intentional architectural engineering. The spatial psychology of the framework begins at the microscale, inside the CSA A277 certified A-frame home. The interior geometry features exactly one protected private bedroom. This strict boundary separation is intentionally designed to support intimacy, marital attachment, and relational trust by ensuring couple exclusivity away from communal household traffic. The remainder of the home is a single, connected, open environment. The secondary bed, study area, and bath, specifically designated for children under 10, remain visually accessible to the primary living spaces. Evaluated through John Bowlby's attachment theory, this shared visual accessibility is critical. Continuous parental attentiveness and mutual visibility may strongly influence attachment security and foster child emotional stability. Removing internal walls and compartmentalization removes the physical barriers to interaction. Research suggests this layout may encourage spontaneous family engagement and naturally increase communication frequency. The interior architecture actively limits domestic isolation. The house itself functions as a structural support system designed to facilitate family cohesion. Moving to the boundary between the private home and the public community, the A-frame structure utilizes a one-way front glass wall. Residents have unobstructed visual access to natural light, neighborhood activity, and external greenery, while remaining entirely invisible from the outside. This regulates circadian rhythms and creates psychological openness without compromising personal privacy. Biophilic design theory suggests this continuous, passive observation of nature and outdoor play may support emotional restoration, reduce stress, and potentially mitigate depressive feelings. Beyond the glass wall, the community relies entirely on walkable pathways. Urbanist scholars like Jane Jacobs and Yang Gell have extensively documented that neighborhood vitality depends on the life between buildings. Active, human-centered streets are a prerequisite for civic safety. By replacing car-centric roads with pedestrian social infrastructure, these pathways enforce casual social interaction, build neighbor familiarity, and provide natural surveillance over public spaces. Walkable micro-neighborhoods convert isolated residents into active social participants, a shift that can positively influence the baseline of preventative community health. The broader layout is governed by a strict geographic constraint. Every home within a 40-unit cluster sits precisely a 4-minute walk from a central hub. This 50 by 50 foot community center is explicitly programmed for intergenerational use. It combines youth athletic courts, senior sitting areas, and essential 8 by 10 foot commercial shops and dispensaries to serve the 80 to 100 local residents. Consolidating daily civic, social, and commercial needs into a single, highly accessible hub establishes a shared rhythm of life, which may systematically reduce neighborhood disconnection. This physical proximity directly activates Robert Putnam's social capital theory. Frequent, informal interactions in shared spaces are the mechanism through which mutual support networks, collective identity, and social trust are built. Social neuroscience research, particularly the work of Matthew Lieberman, highlights that the human brain treats social connection as a basic survival need. In AHT, this communal space operates as vital emotional infrastructure. The proximity of the interactional hub allows researchers to evaluate whether this specific physical infrastructure can reduce the environmental stressors associated with social fragmentation, potentially serving as a structural anchor for preventative community health. To maintain this intimacy, each 40-house cluster is strictly enclosed by a physical boundary fence. Environmental psychology research suggests that clearly defined, semi-protected boundaries establish a strong sense of territorial identity and collective belongingness while lowering external threat perception. Preventing unfamiliar through traffic builds a localized environment of high trust, creating a spatial zone where children can achieve independent mobility safely. This high-trust environment scales modularly. 4 individual 40-home clusters interlock to form a single cooperative 160-home town, expanding the localized economy without diluting the social density of the individual hubs. The entire modular town is then surrounded by agricultural greenlands, embedding ecological sustainability, food resilience, and visual calmness directly into the community perimeter. This specific fractal scaling protects intimacy at the neighborhood level while expanding necessary infrastructure at the town level. It is designed to prevent the anonymous, overwhelming isolation inherent in mega-urban models. The psychological and architectural rigor of the AHT Living Lab framework is comprehensively supported by highly efficient operational economics. The unit metrics are precise. A fully furnished, 2-bedroom, fire and waterproof home reaches the market at $200,000. Built in is a $40,000 per unit profit, demonstrating human-centric design doesn't preclude strong financial incentives. With a rapid 3-month readiness timeline, the framework is engineered to quickly address the massive, escalating demand for affordable housing within the Canadian population. AHT solves the economic scaling problem by aligning high-speed, affordable deployment with sustainable profitability, allowing these psychosocial benefits to be deployed globally. This intentional design may offer distinct advantages to specific demographics: seniors seeking integration rather than isolation, single mothers needing passive community support, refugees requiring stable socialization, and emotionally vulnerable populations. By embedding social infrastructure directly into the physical pathways of daily life, the model systematically targets loneliness reduction and emotional support. As multiple AHT modules interconnect, they form chains of towns and cities, creating sustainable regional ecosystems across North America. This framework presents a rigorous opportunity for postdoctoral research, policy innovation, and affordable housing studies. Building a sustainable future requires a shift toward living environments meticulously engineered to support emotional connectivity, psychological stability, and the complex requirements of human flourishing.